this video, guys, we're going to be looking at the pros and cons of hair transplant surgery. Is it safe? Is it effective? And is it worth your money? If you've just found out about the channel, do make sure to hit subscribe and hit the notifications button so you can be the first to know when we upload a new video. And if you're worried about your hair loss, click the link in the description to take the HairGuard hair loss quiz, where you'll receive free expert advice on how to regrow healthy hair. Now let's get into it. The advantages of getting a hair transplant. Straight up, guys, the main benefit of this procedure is that it does work. Hair transplants are for real, and unless you were very unlucky, you will at least get some of your hair back. There are two main types of hair transplant surgery performed today. One is follicular unit transplantation, referred to also as strip excision, and the other is follicular unit extraction. Both of these methods rely on removing healthy hair follicles, known as donor hair follicles, from the back or side of the head and then transplanting them onto the balding or thinning areas at the top of your head. Now, we have covered these methods in other videos, so I won't go into too much details here. Very briefly, one of the main differences between the two methods is how donor follicles are removed. In strip excision, a strip of skin is removed from your head and individual hair follicles are then dissected out of this strip before being carefully placed back on your head. In follicular unit extraction, on the other hand, thousands of donor hair follicles are actually individually removed from your head using a surgical micro-punch tool. Now, both of these methods work and they can both give natural looking results, though if we had to pick between the two, follicular unit extraction is probably superior. The other benefit of a hair transplant is that it is relatively quick. The surgery itself is complicated and can take up to 12 hours, but it is performed under topical anesthesia. So you can leave the hospital the same day and be back at work the following day. If you don't have the patience or inclination to make permanent lifestyle changes or stick to long-term treatments like natural supplements or doctor-prescribed medications, a hair transplant is certainly the way to go about it. Now guys, let's go through the downsides of transplants. The big one is obviously the money that you will have to spend on the procedure, which can actually go up to the tens of thousands of dollars. So if you are not a high earner, you'll probably have to spend a considerable amount of time saving up for a transplant. Another major downside to the transplant is the risk of complications. The most common complication is folliculitis, the inflammation of the hair follicles. This can happen weeks or even months after the transplant. Now, another common complication is a temporary phase of increased hair loss, referred to as telogen effluvium. This will usually occur 6 to 8 weeks after the transplant, but it does, don't panic, it is only temporary and the hair will grow back. Now, another downside is the risk of going with a surgeon who is not experienced or not competent enough. Hair transplants are part science and part art. Consider that in most cases, the surgeon will have to recreate your front hairline from scratch. Think about how much skill and experience a job like that requires. If your surgeon is not up to the task, you will end up with unnatural looking results or even flat out poor hair growth. Usually around 85 to 90% of transplanted hair follicles will survive, but if the procedure is poorly executed out, this rate can be lower. There are also downsides associated with the strip excision method, and which can be avoided if you opt for follicular unit extraction. The most obvious is the scar that the strip excision will leave. The surgical methods involved in stitching up the strip have improved in recent years, but there will still be a scar left in the donor area of the scalp, and this will be permanent. And if you have repeat transplants, the scar will only become more conspicuous. So are you a good candidate? We've covered the pros and we've also covered the cons, but I did leave out the most important question for the end. And this is, am I even the right candidate for a hair transplant in the first place? If you're not a good candidate, all the theoretical benefits of cosmetic surgery will not amount to much, and all the hassle and expense will have been for nothing. So here are what make a good candidate for this procedure. Number one is your age. If you are too young, say in your 20s, and certainly in your early to mid 20s, then this procedure is not recommended for you. There is a good chance that your hair loss has not yet stabilised, and imagine spending all of your savings on a transplant only to see your hair loss resume further down the line. With most types of surgery or medical intervention, the earlier that you take action, the better. Hair transplantation is not one of these. Number two is the density of the hair in the donor area of your scalp, as well as the laxness of your scalp. You generally need at least 150 hairs per square centimetre to allow for sufficient hairs to be harvested without adversely impacting the appearance of your donor area. Also, if you opt for strip excision surgery, then the tightness of your skin will determine how easy the wound will be to stitch up and how well it will heal. If your skin is very tight and tense, then it might be difficult to stitch the whole thing back together. Whereas if your skin is too loose, then the scars will tend to be more significant. In this case, you should consider follicular unit extraction. Now, number 3 is your general health. If you suffer from bleeding disorders, lung diseases, or are on certain types of medication, then this is not the kind of surgery that you want undertaking. Number 4, and perhaps most important, is your expectations. Guys, if you expect to have the thickest, richest hair and grow a rock star ponytail, you will be disappointed. The technology for that is just not there yet. You'll be equally disappointed if you expect overnight results. We are talking a good 9 months before you can see full results, and it may even take longer. So guys, that's it for today. Let us know in the comments below if you thought we missed anything out. Till next time, Leon from hairguard.com.